I'm joined today by PennDOT's Acting Secretary, Yassmin Gramian. How have PennDOT's construction projects been impacted by the coronavirus outbreak?
Good afternoon, Francine. So PennDOT quickly put all construction projects on hold as of March 17th. We started on March 16th and then, March 13th, and then all construction projects were put on hold regionally and statewide as of March 17th. And of course, the reason we did that was to minimize the exposure of PennDOT employees and contractors, as well as everybody who was somehow engaged with the construction activities, and also the community. So we were very concerned about exposing risk to the communities.
The governor has said that construction may, not necessarily will, but may begin on May 1st. How do you decide which projects are critical priority projects that should resume?
So we actually, although we put the construction projects on hold, we resumed the critical projects. Within 2 weeks, we wanted to make sure that those projects were in critical conditions and could cause some emergency situations or unsafe passage for the public using the roadway system to be addressed. So we resumed some of the construction activities. We took care of some of those critical projects. There were a list of 61 projects that we focused on. But and we actually, the other thing that we did, Francine, immediately after we shut down the construction projects, we gathered together with all our partners, business partners. We put a team together with the contractors, the consultants. We brought in Pennsylvania Turnpike into our team. We actually brought in our partners on the federal highway side, and we put the team together with the assignment of how can we resume those construction activities under the current guidelines and executive order. We wanted to make sure that as we phase into more construction work, that the people who are out there working at the construction site, they're working in a safe environment, that whether it's PennDOT's employees or contractors, whoever is somehow engaged, they're in a safe environment, following the COVID-19 protocols as well as CDC protocols. So this team actually worked tirelessly developing all the guidelines, developing a phased approach to resuming the construction activities, sort of prioritizing the projects. So these projects that were already under construction wouldn't fall into a critical phase, an emergency phase. So we were very mindful of the status, doing the assessment. And I'm very proud of the work that the team did. And of course, we were ready when the governor made the announcement May 1st. We had this plan ready to sort of phase into the construction, but obviously May 1st being the deadline, we can actually resume all construction activities. Our intention is to resume all the construction projects. However, we still have to be very cautious and make assessment, specifically in the red zone area.
What happens to when a construction project had an incentive built into the contract prior to the pandemic occurring in Pennsylvania? What happens to those incentives within the contracts now?
That's a great question. Actually, we're looking into it. The claims and the schedule and the delays and how it's impacting our business partners, our contractors, as well as how it's going to impact PennDOT is a major concern of us, obviously. And we're looking into it. We have our team of engineers. We have our team of course, the attorneys, the legal team, the counsel. They're all looking into it. We also are working with our partners. I mean, this is a situation with shared sacrifice for everyone, and we wanted to see if there is a way to minimize the financial impact on all areas, on all partners.
One would assume that there's decreased traffic because of the ongoing stay-at-home policies. Will that help to expedite these PennDOT projects in any way?
That's definitely one area that we're looking into. I'm sure you realize, and you may have heard, that the traffic has decreased drastically on our major roadway systems, somewhere between 45 to 55%. Obviously, it's a good time to accelerate some of those construction activities. And this is another, again, part of the discussions we are having with our partners, the contractors. Is there a way that we could, close the gap that was created with the delay over the past 5 weeks that we had with the construction activities by giving them, some allowance in terms of shutting down the lanes, maybe. We're actually looking for their suggestions, be honest with you. We're not telling them, we're working with them to come up with some ideas.
In light of social distancing orders, what kind of guidelines or recommendations can you give to the operators of public transportation systems?
That's been a major concern of us from day one, honestly, and we've been working very closely with our public transit partners. Deputy Secretary for Multimodal has had ongoing discussions with, of course, the big public transit agencies in Allegheny County and in Philadelphia, SEPTA, our biggest partners and the ones who had the most amount of exposure, continuously talking to them, making sure there is alignment, with the guidance, as well as, we're there available to them to help out as a partner. Obviously, concern is with the smaller transit agencies, public transit agencies, mostly because the resources are not there. So we try to help as much as possible to provide them with the cleaning supplies, with masks, with everything that's needed to create a safe environment for the transit drivers, as well as the people who are actually using the transit services. A lot of those people are vulnerable group of our society, elderlies and people who don't have any other means to either get to the hospitals or, places that they have to work for essential services. So we wanted to make sure that there is enough safety in place, COVID-19 protocols in place. It wasn't easy, Francine. We had to work together to, bring them supplies, masks, and help them out throughout the process. They've been great partners with PennDOT. They're constantly coming up with great ideas for us. They're expanding their services. They're expanding their operations to weekends, longer hours to accommodate, those couple hours in the morning. So people over age 65 can actually go and do their shopping and whatnot. So there's been a lot of collaboration. And I'm also pleased to say that it goes beyond the Department of Transportation. We are actually talking to our sibling agencies in the state. We're talking to Department of Education. Department of Correction has been a tremendous resource to us, providing us with the mask, as you may have heard through social media, to help us and enable us to actually resume some of these activities that we've managed to resume over the past several weeks.
Can you talk a little bit to consumer services? For example, driver's licensing centers are closed right now, but what services are available online, and what happens if somebody's license or registration perhaps expires?
Yeah, great question. As you may know, PennDOT has 75 driver's license centers and another 27 photo license centers throughout the state. And these driver's licensing centers and photo centers are the locations where there's more public touch points, and we were very concerned about them. So when the governor put the mitigation guidance in place, obviously we had to close down those centers statewide. But we also understood the angst and the concerns of the public with having the proper identification cards, licenses, and a lot of the folks in Pennsylvania, they had their IDs and their driver's licenses expiring. They had learner's permit that was expiring. Vehicle registrations could have been expired during this period that we're closed. So we immediately, one of the actions that we took was to extend all the deadlines to May 31st. So that's the current condition. And I know that there's been a lot of questions about that from the public. We try to be very, open with discussions and on social media about this. We put a lot of information out there through multiple outlets, and I hope it got carried on to the public, so to reduce the anxiety and angst of the public with the documentations that were expiring. And there were a lot of other transactions that could be done online, and they remain to continue and be being performed online. So, and I also have to tell you that we're looking into actually adding more services online. So we're constantly evaluating and trying to be innovative about the way we're doing business, and if there is any possibility to go online with multiple opportunities within the drivers and vehicle services. One of the things that we did was, assisting the car dealers who can perform online services to open up. So we're providing all the documentations that's needed to help them with processing the transactions.
Finally, before we run out of time, I'd like to talk just briefly about rest areas. When the governor's initial orders came out, all rest areas were closed. Some of them have since reopened. Can you explain what amenities are available for both our truck drivers as well as someone who might need to travel, and how they can find out what might be available before they plan their travels?
So the rest areas throughout the state, yes, you're absolutely right. Initially, they were closed, and the reason for that, obviously, we wanted to make sure that we have enough supply, that we know what to do at these rest areas, how often to clean them. We wanted to make sure the people who are maintaining the rest area, they're working in a safe environment, that the truck drivers who are actually delivering life-saving amenities to the public have access, but they also have access to a safe rest area. So that was part of the reason, the major reason that we closed down, because we again wanted to evaluate, the supplies that we have, and to what extent, we should start opening, and if we have enough resources and people to wash the rest areas and clean the rest areas. Majority of the rest areas, if I would say 80%, 90%, they're open now. And with regards to, and as you know, Pennsylvania Turnpike also opened up the rest areas. The gas stations, limited amount of food is available. At our rest areas, we're really limited. It's basically using the facility, nothing beyond that. We just wanted to make sure that, they can use the facility. There was a conversation about some food trucks coming into Pennsylvania. We're still evaluating that. We wanted to make sure that as we are taking actions and we're providing opportunities for folks who are actually using these facilities to provide food and whatnot, that, we're creating a safe environment for everyone.
We've been speaking with Acting Secretary of PennDOT, Yassmin Gramian. Thank you very much for joining us today.
Thank you so much. Appreciate it.
PCN is committed to providing the people of Pennsylvania with the most up-to-the-minute information about coronavirus. Daily special programming with civic, business, and government leaders and how COVID-19 is affecting the community. Airing weekdays at noon and 8 p.m. Live special coverage of the Governor and the Secretary of Health, as well as programming designed to inform and assist everyone impacted. Go to PCNTV.com for the latest information.
We're joined by Shauna Boscaccy. She is founder of Volstead Partners. You had written in the York Dispatch that you felt like the Pennsylvania Liquor Control Board failed to make their liquor monopoly a success. Why is that?
I do. And I think that unfortunately with everything going on, the board has gotten an incredibly bad rap. I do think at the end of the day, the system itself is to blame. We were founded at the time when we had a governor who really believed in prohibition and really didn't want alcohol to be accessible. So when you think about how our liquor code was set up and how the system itself was set up, it was never truly meant to be profitable. It was never truly meant to have all this access to consumers as it does today. And I think because of those inherent values in the system, the board has done the best they can. However, you can't make a system fit into modern times like it does now. Consumers expect products in 2 days. They expect constant access that, the modern consumer has. And based on how we were set up with, all the bureaucratic levels that go into running the PLCB retail arm, I don't think that they could ever be successful.
Since the closure of non-life-sustaining businesses, how would you rate the Liquor Control Board's ability to conduct sales through an online platform?
I mean, they just haven't been able to, and again, I think that, they have spent great time and expense trying to make that system work in this day and age. And, it was never set up to work for 13 million Pennsylvanians. It was set up to kind of be a fallback. And so when it was the only avenue, when we physically shuttered the state stores, the system wasn't ready for that. And they never set it up to be ready for that. So I think that was part of the problem.
What were the biggest concerns that you've heard about the online sales?
Not being able to get through at all. Just constant frustration in that, if you shutter the state store system, I should be able to get something. I mean, why can't I just get one bottle of vodka? Why can't I just get one bottle of wine? So there's a lot of frustration in that. It was more of a frustration, I think, than anything.
The Liquor Control Board has since now opened up their sales for also phone-in sales and curbside pickup. Has that helped?
I think it has. And today they just announced, they're going to open up another 389 stores, I believe, and that should help. And, I think that to the benefit of the retail clerks, unfortunately, they weren't allowed to continue to operate as other retail operators were. I think that they absolutely had the capacity to do curbside sales from day one, and the governor did not permit the retail to operate to their detriment, unfortunately. And I think you're going to see a lot of clerks, as they did, pick up that Monday morning with a whole new system and do the best that they could, with having two people in a store and running around checking product. And, it's a new system. It's a new world for everyone, and everyone's doing the best they can. And I think with opening those additional stores, you're going to see more consumers get access, more consumers get through, not so many busy signals, because then you're not relying on 70 stores, you're relying on 500. So I think it was a good move by the board. I'm glad the governor is finally permitting them to operate their business so that we can, consumers are happy.
Do you think that the closure of state stores and some of the customer frustrations will lead to a renewed call to consider privatization in Pennsylvania?
I mean, absolutely. I think the problem is that, had they been allowed to operate, you wouldn't have, the PLCB in the headlines every day. There wouldn't be the national stories of consumers fleeing, to other states to get access to a product that was readily available to them prior to shuttering the state store system. And I do think that's a real problem with what, the governor's decision to unilaterally close the state stores and not allow the board to operate in the manner that other retail was operating. Luckily, beer distributors were still allowed to be open. We have wine and grocery stores, and we have, a plethora of local distilleries, wineries, and breweries now, so that there was still some access to alcohol, but it's not what we're used to. It's, Pennsylvanians want to be able to get their specific liquor that they like, and to close that down and to have the PLCB in the spotlight like that and having people fleeing the borders has really shown that the system can't support moving forward. And I think that's going to be why there's going to be this, this invigorated push to move something to change the system.
Privatization has been attempted by several administrations in the past. Why has it failed to become law?
There's lots of reasons. And, I think that when you look at all the different reiterations, back to Thornburg. Thornburg was one of the first people pushing it. It's hard to just kind of overhaul an entire system in one fell swoop. Especially a system that has been set up in the way it has. You have to make sure that consumers always have access to those products. You have a workforce that has invested, decades into making that system work. You have a PLCB that has invested decades into making that system work. So when you're looking at all the different moving pieces of, well, where does it go? Do we give it to private business? Do we expand? Do we, there's a lot of moving pieces. There's a lot of vested interests in the liquor world. So you have a lot of people screaming that, you're taking away what I've invested in the system and I'm not getting anything in return. And there's a lot of chatter. And so to make a true privatization bill work where you're going to just overhaul the entire system, I've always said nobody needs to be happy. You get one thing and you're unhappy about five because sadly, that's really the only way you're going to move it forward at this point.
Some may argue that the Liquor Control Board generates revenue for Pennsylvania. How do you respond to that point?
I mean, they do. And at the end of the day, I will respond to that they do. Unfortunately, at this point, I mean, their operating costs are so expensive that when you're selling alcohol to the extent at $2 billion and your profit at the end of the year is $190 million, I mean, anyone looking at books in the private industry would say, we got to figure something out. And, also when you look at the taxes that are collected, when you look at the liquor tax, then you look at local sales tax and Pennsylvania sales tax, those will continue to be collected no matter who's selling the product. And I think that, in that regard, as long as whenever you're looking at all these different privatization schemes, as long as you're finding a way to ensure that we're not losing that tax revenue and we're not losing any of that revenue that the LCB transfers to the general fund, be it, 125 million, 185 million, you can do that with licensing fees. You can do that with other things, but there's a lot of other things the board pays for that has to be taken into account, like the liquor control enforcement. So you have to make sure that as you're winding down privatization, you're ensuring that all those things are covered and we aren't losing money. And that's another big part of doing it's a big bill and it takes a lot of people coming to the table and, expressing their concerns and validating those concerns and kind of, looking at all the different avenues to make additional money and make sure that Pennsylvania consumers are happy, because at the end of the day, that's really what the important part is.
At one time, you served as legal counsel to the House Liquor Control Committee. What were the biggest concerns you heard among lawmakers regarding privatization?
So really, I mean, one of the biggest concerns about lawmakers is really the public health aspect. I mean, because when you're looking at doing something like this, alcohol is alcohol, and you have a lot of chatter from the public health community. And so one things that, legislators have to do is they have to really walk that tightrope balance of we need to be really careful about public health while also balancing treating Pennsylvania consumers like adults. So, a lot of people at the beginning were very concerned about having the ability to buy, wine, spirits, and beer in a grocery store because there's children there and you take children there. And is this really the public health aspect that we should be putting out there? So, I mean, really the loudest chatter from legislators has always been, is this the safest thing that we should be doing for public health? Isn't the whole point of having a liquor control system controlling access to alcohol and having the ability to have public health experts come in and, really moderate and say, like, this is a controlled substance. You have to be careful with it. You need to use it in moderation. And so if we just allow everyone to sell it, are we doing our job as a control system and also as legislators? And I think that's really, it's an important thing. Public health needs to be at the table when you're discussing all this.
What role do the state store employees who are unionized play in this debate?
I mean, absolutely a huge role. I mean, I talked about that in my op-ed, and it was one of the loudest calls when I was there, and it's an absolutely valid call. I mean, to be honest, when we first started looking at all the different privatization bills when I was there, we were looking at different ways to kind of maybe set up an education fund for them or ensure that they had access to additional employment elsewhere within the state. And I think the thing I was most shocked about is when I asked for the spreadsheet of employees was how long they had been employed as an employee of the Commonwealth. And, because you think when you're a retail clerk, it's constant turnover, no one stays in retail jobs. A lot of these people had been there for 20 and 30 years. And so that's when that was shocking to me. And that was my first realization that we really do need to make sure that these employees are at the table and taken care of because they have served the Commonwealth. And they do have a vested interest in making sure that this system has been successful as it has been, to the extent that it has been. And I do think that that's really important that legislators moving forward really look at ensuring that those employees are taken care of to the best of our ability.
House Speaker Mike Turzai has been responsible for authoring a lot of the modernizations that have taken place in 2016 for liquor sales, along with some of the past privatization efforts. Now that he has a pending retirement, are other lawmakers poised to take up the fight in the same issue?
Yeah, I think you have a lot of, Rep. O'Neill is obviously bringing forth a new privatization bill based similarly on other privatization bills that have moved through the House in the past. I think that you have a lot of lawmakers who have been there for a while who have served on the Liquor Control Committee who now understand all the nuances that go into the liquor industry and all the different players. So I do think you're going to see more people interested in getting something done. It might not be as overreaching as some privatization plans in the past. But I do think there are going to be legislators who are going to stand up and say, oh, this is absolutely something we have to do. I haven't supported this in the past, but I mean, look at what happened. Our consumers are not happy with what happened during this, pandemic, and now we have to do something to make them happy.
Shauna Boscaccy, founder of Volstead Partners, thank you for joining us today.
Thanks so much, Francine.
Join our guests for insights on issues impacting local government and the citizens of Pennsylvania. Created by the Pennsylvania State Association of Boroughs, Inside Pennsylvania Boroughs connects you to legislation and policy that will affect you and your family. Your host, Chris Kapp, and his guests discuss current affairs that matter to you most. Connect with your state by tuning into Inside Pennsylvania Boroughs on Sundays here on PCN.
We're joined by Allegheny County Executive Rich Fitzgerald. You're encouraging Allegheny County residents to vote via mail-in ballot this time. Why is that?
We are, Francine, and the reason is, we know in this situation we're in with the coronavirus, COVID-19, we want to keep people as safe as possible, and people have been doing their work remotely, other activities remotely, even family meetings on Zoom, those type of things. Voting is one of those things that we can do by mail. The legislature and the governor passed last year the ability for no excuse absentee voting or voting by mail. When people go to vote, and I know the most of us that do, we go and there's those 5 workers that are sitting there to process you and get you signed in. Typically, those folks are retired and in an age that people are more vulnerable to the COVID-19. And also the voters themselves have got to leave their house, go out, go through that process, and there's obviously the potential for contracting the virus. So what we have done in Allegheny County is we had a very, very robust marketing campaign urging people to do this on their own. But even since then, we've decided to mail every single eligible voter an application for the mail-in ballot. And that's what we're in, with postage prepaid, envelope, so that they can send it back. It's already addressed back to our election department to make this process as easy as possible.
If an Allegheny County resident still wants to vote in person, can they do so?
They will be able to do so. It will be very limited because in Allegheny County, we're the second biggest county in the Commonwealth, and we have over 1,300 polling places. And that would be 5 workers per polling place, about 6,500 workers. There's no way we can ask them to do that. And many of them have already said they're not willing to come out. And I certainly can't blame them in this instance. So we're going to have polling places at the municipal buildings. We have 130 municipalities in Allegheny County. 129 of them are going to have their own voting place at the municipal building. Some of the bigger municipalities might have 4 or 5 stations. Some of the smaller ones might just have the one voting place there for people to do that. In the city of Pittsburgh, which is a little bit bigger, each city council district represents about 30,000 constituents. So we're going to have one in each city council district in the city of Pittsburgh. So we're trying to make this as easy as possible. We know it's a different time, but we just can't staff 1,300 polling places all throughout, in churches and in bingo halls and in all the different places that we have them in Allegheny County.
Has the Wolf administration given any indication whether they would push for the entire state to follow suit and pursue mail-only election?
I think they probably would like that. I don't know if they've had those discussions with the legislature, and there may be some pushback in certain segments of the General Assembly or in the Senate. So that might be something we certainly look at. It'll be interesting to see in our county and throughout the state, quite frankly, how many people on June 2nd for the primary avail themselves to the vote by mail. We typically would assume we'd maybe get a 20% turnout for a primary election in which both presidential nominations are basically finished. So you don't have that issue. You certainly have some primaries for some of the state Senate, state House, and congressional races, but you don't have the big push that you would often have in a presidential like we will in November. So it'll be interesting to see how that compares to what the turnout will be on the vote by mail. Will it be 30%? Will it be 40%? Will it be 50%? We don't know. It's uncharted waters, to be honest with you.
Some have voiced concerns about voter fraud. Are you confident that this primary election can be conducted securely under these unusual circumstances?
Absolutely. You know, it's funny because people were worried about the voter fraud, and we had the voting machines last year, and obviously the state changed all of that, and we have now the paper ballots that are being voted on. I'm very confident because you have to sign that that envelope that sends the ballot back, and they scan it and they go through comparing it to your signature. And if the signature doesn't match up, it's going to be rejected. So I'm very confident. When you look at the national figures of the amount of fraud, or even the amount of fraud that's alleged, it's extremely, extremely low on the mail-in voting number. So other states, 5 states in the country actually vote only by mail, exclusively by mail. They don't even have the in-person voting. Oregon's done it for over 20 years, and they've had no problems with it. So I think that gets brought up, but I really don't think it's an issue at all.
What kind of feedback have you received from residents of Allegheny County about being encouraged to mail in their ballot this primary?
It's been very positive because, you know, people are very fearful, obviously, right now during the COVID-19 pandemic that we're living on. They're fearful on a whole lot of things. So if there are areas of operation that we could do online or virtually or by mail, and just like this interview we're doing or many of the other meetings we've been having over the last month or so, we haven't had in-person meetings. We haven't had in-person events. They've been virtual. So voting is one of those things that we can't do it online, and maybe someday we will. I don't know about that, but at least now it makes it very easy. They get it in the mail. They can fill it out, send it back by mail. They can vote in their living room and still participate in the democratic process without putting their health and the health of others at risk.
If we can go in another direction before we run out of time, how are Allegheny County hospitals managing in terms of ICU beds, ventilators, things that they might need to meet needs at this time?
So far, very good, Francine. It's really been, I got to give the folks in this region a lot of credit. You know, we're known as an eds and meds area of Allegheny County with the University of Pittsburgh Medical School, with UPMC and AHN, two big medical facilities, and a health department with a leader who's really has a lot of credibility. So the folks have really paid attention to not just the county executive or the mayor or the governor or the president. They're listening to the health professionals. They're listening to the medical experts. And our numbers have been very, very low compared to other parts of the state. So both on hospitalization, on ICU, on ventilation, and on the number of positive cases. So we've been very fortunate. People have been very, very cooperative. You know, the line we use is we like to come together, but we like to come together by staying apart. And that's what we're doing right now. And people have been very good about staying apart.
How is Allegheny County doing at operating test sites right now?
We've actually been pretty robust compared to most places. I'd still like it to be better. I'd still like to have more testing. And Dr. Bogan, our health department director, has come up with a strategy that we think we're going to be able to get even more testing available. Again, I talked about those two UPMC and AHN have had a lot of robust testing throughout, spread out throughout the county, and some in the city, some in the North Hills, some in the South Hills, East, West, et cetera, Mon Valley. They've been getting out there and doing that, as has Rite Aid and some other organizations who've been doing that. But it's not. Testing isn't for everybody right now. You still have to go and get a prescription. You go through the screening process, et cetera, to have some symptoms, that type of thing. But as we come out of this, as you know, the governor has laid out his plan for each region to come out of a red, yellow, green, depending on how many tests. Obviously, we want to have a good, robust amount of testing to know where our citizens are and where the spread is within our community.
As you just referred to it, the governor announced that restrictions may begin lifting as soon as May 8th. How do you feel about that?
I think it's very appropriate. I think the governor has handled this extremely well. I'm very proud of the fact that we have a governor who has relied on the science. He hasn't taken, you know, there's obviously political pressures on both sides sometimes to go one way or the other. And I think with Governor Wolf and his team, Secretary Levine, they've done a tremendous job. They've used science, they've done the testing, they've listened to the experts, and they've made decisions based on health and on science, and again, not on the political pressures that sometimes occur in Washington and Harrisburg. So I think the way that he's laid out this plan to do it on a region by region basis makes a lot of sense. We know some places in the Southeast and the Northeast have had much higher cases. much higher testing, hospitalizations, et cetera. Parts of the middle of the state, not so much. In the western part, southwest and northwest have also had lower cases. So you almost have to judge it on a case-by-case basis. When we did a lot of the shutdowns early on, it was the fear that our hospital systems and our ventilators, ICUs would be overwhelmed and we wouldn't be able to take care of people. So we see right now that there's have been good numbers over the last month or so, and we want to hopefully that obviously want to continue that, but we can start to slowly open up certain things. And I think doing it on a region by region basis as opposed to one size fits all makes sense.
What do you think needs to occur before Allegheny County is ready to open up again?
Well, we just need to continue to have the good testing numbers that we've had. I know that the governor and the secretary have put out this plan that says, you need to have less than 50 cases per 100,000 population over a 14-day period. We have been well under that here in Allegheny County. We want that to continue. We still urge people to make sure they physically distance. What we say here is they physically distance while they're socially connected, like we are here online. And people continue to wear their masks. People continue to use the PPEs, and people continue to be smart and listen to the medical experts on the mitigation practices that we've been doing. And we want to continue that as we open up and people go back to work at some level. They may not be going back to work the way they did prior to the shutdown, but it's, as we say, it's a new normal, and we've all got to adjust to that and work, be smart and protect our community, protect our families, and protect our health.
We've been speaking with Allegheny County Executive Rich Fitzgerald. Thank you for joining us.
Good to be with you, Francine. Take care. Have a good day.